Nick's going to demonstrate some soft tissue mobilization for the calf muscles to try to work on improving ankle dorsiflexion. So first we're going to use a foam roller. At first Nick's just going to kind of take one leg on top of the foam roller and just kind of work his body back and forth, kind of feeling for tender areas or areas that feel a little tight, a little more taut. If he finds one spot, he can kind of hold some pressure on that area, and he can work his foot up and down, or hold a little pressure on that area and just do a little small oscillation back and forth, or he could even try to get on the edge of that restriction and try to shear his leg back and forth across that restriction. Really, there's no perfect specific way to do it, and probably feels what works best for the individual. The other, if he wanted a little bit more pressure, he can cross that leg over and repeat, do the same thing. Probably spend anywhere from 30 seconds to a minute kind of working throughout the lower leg, just to allow you to see a little bit better. If we want to hit the outside portion of the calf, we can roll our foot outward. If we want to hit the inside portion of the calf, we can really roll our toes inward and kind of look for some different restrictions. If we want to take that one step further, we can get rid of the foam roll and come up into a half kneeling position. We're going to grab either a PVC pipe or maybe a massage stick of some sort that we can kind of utilize. The nice part about this position is Nick can bring his knee out over his toes to create a little bit of the dorsiflexion we're trying to improve, put the muscle on stretch, and then he can use that massage stick or PVC pipe to search for and find restrictions. When he gets on a restriction, again, he could hold pressure. He could kind of rock back and forth a little bit, trying to create a little more dorsiflexion, or he could get on a little bit different angle on that and try to kind of create that shearing movement across the muscle.